Hi, this is your community health advocate, Paula Sanford. I'd like to thank you for tuning in to another one of my videos. You may have seen some of the others on my other channels, but I definitely want to talk to you as a community health advocate, especially in the area of gerontology. A whole lot of seniors who have been admitted into nursing homes, assisted living facilities, physical therapy type of situations. I'm noticing in a lot of the long care facilities that there is a lot of mismanagement. I don't say that just from hearsay. I can say that from personal experiences. A lot of time, this population of people, they don't speak up for themselves. They may have fear, or they may feel that there will be retaliation against them. For an example, could be their food. They may not enjoy the food, or may not like or want the food that is served to them. And although the kitchen area is giving tickets saying, well, they got meatloaf and mashed potatoes and gravy with the side of corn or sweet potatoes or whatever the menu is, that there should be an alternative. And sometimes they're given tickets that say they're getting one thing, but they're not. And then being afraid to complain to the kitchen because they figure, well, they might spit in my food or they may do something. All of them have a boss. And if anything, you can go all the way to the top administrator of the facility and make those things known, because there is a place to complain about that, and that is the Center for Medicare Services, and they govern the affairs and audit places to make sure that they are compliant. What I like to say to you is, if you know someone who is in a facility, a nursing home, assisted living place, anything like that, especially a long-term care place, and they have a risk of falling, or if you're at home and you have a risk of falling and you have to hold on to furniture, there's a thing called a MORSE FALL SCALE assessment. And what happens is you're able to measure someone's risk of falling, and it can be sent to the doctor's office or the podiatrist's office or the specialist office, whatever, and let them see that this person may need further assistance. And it's only about 4 or 5 questions. If you know somebody that needs that, or you need that, contact me at communityhealthadvocate2@gmail.com. You may know someone that's at risk of cardiac care, or they need a annual health assessment. It won't cost you anything to have this done. I'm not charging anything. It's one of the services that I do. And even the doctors will benefit from it, because it won't cost the doctors anything to see this assessment, and they'll know what to follow up with you for. So I won't even need your Medicaid or Medicare number or anything like that. I'll basically just need your name, your email address, your phone number. I'll ask you if you're at risk of falling, if you've ever fallen, or just say a parent or somebody, if they've ever fallen or at risk of falling. I'll ask you about how you feel when you walk, or are they normal, are they weak, or do they need assistance? Do they use any kind of ambulatory thing like a walker or a cane, or are they holding on to furniture or the wall when they're walking, and at risk of falling? And then lastly, I'll ask you what's your doctor's name and what health care you use. Let's say you use Meridian, or some kind of Medicare or something like that. I'll just put that there, and If you have an email address for them, that's really good too, because that helps me to get the things to them. And I want you to know that my team and I are all HIPPA compliant. So if you know anybody, or even if you like to help, I'm looking for people that want to help, and they can work as independent contractors from home. They'll have all the administration stuff done for them, and everything can be done virtually. But contact me, send me an email to commissioner, no, not commissioner, to community health advocate 2 at gmail.com, and I'll make sure I get that information to you. But again, I want to make sure that our seniors are being taken care of, because that's somewhat of a forgotten population. And a lot of places are just opening up again, and seniors are now being able to see their families. And so, like my mom being in an assisted living place, she told me yesterday that they just opened back up. So there's a lot of things that are going on with seniors, some psychological issues, mental health issues, fear, being a high risk for COVID, that type of thing. So I changed my whole profession, not necessarily, but I've got a different scope. I was doing complementary alternative medicine, which I am, but my focus is more on gerontology management. So now I'm pursuing my degree from the American Intercontinental University in order to get my bachelor's in gerontology management. So I know that's a mouthful, and I'll talk with you guys really soon. Thank you for watching this video. And remember, contact me if you think you're at risk of falling, or you know someone at risk of falling, or if they're in an assisted living place. I can get them some resources that could possibly lead to more benefits, especially those like that are diabetic. There are programs where if you have neuropathy, or you need to have your feet measured, your balance and everything, you may qualify for shoes. I found a nice pair of shoes that I'm going to get for myself, because I do have a problem and a risk of falling. So you have a great day, and I'll talk to you in the next video. Goodbye.